Hi everyone, this is Uriarte, ane.neuro. I'm a diploma in veterinary neurology.
Hi, I'm Joao. I'm a diploma in veterinary cardiology.
And this is to vet or not to vet.
And what is your question?
So my question today is going to be, what are the good tips and tricks to do a good exam for the European College of Veterinary, whatever specialty we are doing, or actually the American College. So yeah. Joao is the chief examiner of the European College of Veterinary Internal Medicine, Cardiology.
Correct.
And so who better to give us some tips? Because obviously we're not going to ask anything about the exam itself, but you make the exam, obviously with the committee, but you make the exam and you also are there to, you are with examiners, right? So you see how people get stressed, and you see also what, you also correct their exams. So I think that having few little tips, which will be probably the same for all the exams, could be really helpful, particularly for those sitting the exam very soon for the cardiology specialty, but internal medicine, oncology, and there's going to be also soon a lot of other specialties that they're going to be sitting. So I'm going to be asking you questions. Do you think that people get very stressed during the exam?
Yes. And we've done it also, haven't we? And that's the other thing. We don't give just the opinion of us on this side, but we've both done it. We've both been through that, and we still remember it. And so, yes, stress is a massive component of performance. And I was going to say, so there's two parts of it. One is knowledge, okay? So in any exam, one is knowledge, the other one is technique, okay? And I think both need to be worked extremely hard. And we've discussed this before. So the process of specialization, of accreditation, is relatively well structured, and hopefully the better structured it is, the better the candidates will perform. Okay, so I suppose you and I remember when we did our exam, I didn't really have a lot of information. I just turned up on the day, I read as much as I could, and they asked me questions and I answered to the best of my ability, but I wasn't very informed about the exam. And things have changed massively in the recent years, and it's good. It means that we as colleges, and I'm sure you feel the same with yours, we're maturing. Okay, we're in the early stages still. We're still very young colleges, and we're learning through the process, as you must. But we are maturing and we are getting much better. And the question of even, does an exam in the end of your training, is that the best way to evaluate a specialist? It's a very interesting question. At the moment, it's what we have, it's what we use, but there are other possibilities where you may actually be evaluated through the process of your training, and that will probably be a better way. And I think there are some moves towards that, but at the moment we still have a final examination. And one component of it is study, read as much as you can, be as informed as you can of what the reading list is. Be as informed as you can about what kind of training you've received. And you and I have both been through it. And you know that in an institution, you may be incredibly biased. For instance, cardiology, you may receive very good training in echocardiography, but you may actually not be very well trained in interventional procedures. Okay, so the minimally invasive lead surgery. So you may want to communicate, chat, share information with your other candidates, with your peers, and understand where your training may fall short or actually not so much. And that would should allow you to choose a little bit. We know that there are some institutions that are incredibly biased for instance, electrocardiography. And we know that those candidates probably don't need to study a lot because they'll be exposed to the highest level, while some others will probably be very echo-driven. I don't know if you feel the same in your training, no,
100%. Yeah, for electrodiagnostics versus imaging, 100%. I think that's a very good point, just to know where you are compared to your peers on each part of the exam, right? Because Every exam has
Perfect.
different parts and different specialties, 100%.
Perfect. So understanding the structure of the exam, and there are two sides of the studies. One, you study to be the best specialist you can be, but you also study to pass the exam. And my recommendation would be train during your training to become the best specialist you can be. But when you study
for the exam,
study for the exam.
And
it is the last hurdle.
Yeah. And study for the exam, that's also what probably you were saying, that because we've matured a little bit, there's more information about what the exam is about. So you need to know what to expect. And there is information in each college about what is expected in the exam, what type of questions you're going to have,
Correct.
and how do you study about it. So let's go a little bit back to you are in the exam, the days of the exam. I remember the night before, the first time that I did my exam, because I haven't done it once, I've done it more than once to be able to pass. The night before, that I was really, really stressed. I was not that stressed during the exam.
The night before,
night of the before of the exam was really stressful, and you couldn't really read. I mean, you feel that you need to have a book in your hands. You don't know what for, because I could not retain anything, but you were very stressed. One thing that I want to ask you is, and I think that this probably is going to be for a lot of people that they sit in the exam soon. How does exam get marked? What is exactly the marking process? Because sometimes I feel that people are using too much time to write too much, to explain too much, to answer questions that they haven't been asked. And we know that the exam has a specific time, right?
Correct.
You need to finish the exam on time.
Correct.
Why do you need to finish the exam on time? Why do you think as an examiner that is important that you finish the exam on time? So maybe they understand what is expected from them when answering that questions.
So that's one of the advice that I've given before, is that you learn a lot by actually putting yourself in the other position. So write some exam questions and create a marking sheet. So we have a marking sheet.
Very good.
Okay. So, and we spend hours debating if what we are asked is indeed what we are answering on our marking sheet. Okay. So there has to be a structure. You don't just write the question and then see what it's answered. No, there's a lot of work that's put into creating that. And you can learn a lot by doing that to your peers. So create an exam question that you think would be an interesting one, and create a marking sheet, because that will make you understand, right? Okay, so obviously this is going to be asked, this is going to be here. And we tend not to ask controversial things. We're trying to find, obviously it's evidence-based in what's been written.
Yeah.
So things need to be referenced also. You don't talk about, oh, well, I've seen this once. No. It's what's published. Okay, every question needs to be referenced. Every answer needs to be referenced. Okay, so but your timing is very, very important. What you said, Ane. Our exams aren't limited by time. They are given enough time to answer, if you do indeed answer what is asked of. And one thing that's very important, and I say this, no one is trying to fail a candidate. Okay, we've all been there. We are in the process of generating specialists. We're not in the process of failing specialists, not at all. These are our people. These are people that will be our peers. No one is wanting to make someone fail. The role of an examining committee is twofold. One, to make sure that the college has a final certification in the end, to make sure that when we come out and we call ourselves specialists, we know that you're stamped with a quality stamp that says, yes, this person has gone through the training, they read all that they needed to read, they were able to answer questions on that. And that means that everywhere we go in the world, if you say that you're an European specialist, people go, okay, these people have been trained. So that's one of the roles.
I know what is the level. Yeah.
Correct. The other one is to allow candidates to show their talent. Realistically, show us what you've learned. Show us what you've been trained. You've been categorically trained. Come and show it on the day. And that's where technique comes a little bit, and the nervousness that you were talking about, because we know that these candidates are very, very well trained. We know that people read. The vast majority of people that become vets, that go through a specialist training, they are resilient. They can work. We know that people don't go into an exam in a blasé way. And that's probably where we get so nervous, because we're so used to achieving. And so it is important to understand that no one's there to fail anyone. We are there to protect the college, to make sure that there's a real certification. And when you come out of it saying that you're a specialist, people will know that you've reached a certain standard. But also to allow, and we learned this in COVID, Ane, when we weren't able to do an exam because COVID cancelled the examination, we felt at a loss. There was 1 year that no new specialist came out, and that's not good. As a college, we're there to train, we're there to generate specialists so we can continue pushing the veterinary world. And so understanding that this will hopefully allow you to relax a little bit. No one's there to fail anyone. We're all specialists, we're all cardiologists, neurologists, we've all been through it, and we understand. And the questions that you'll be asked are questions that we believe to be relevant for your training. And a lot of it reflects on the training after. That's the reality. We don't blame candidates. We try to understand if there's a failure, try to understand the training could be improved. Have you had enough time to study? Were you exposed to the level of questions? And another thing that is important to highlight, Anne, is that I don't generate the exam. There's a group of 7 specialists from around the world with different levels of experience, and we spend hours discussing the questions to make sure
discussing the questions that are sent from specialists all over the world.
And on top of that, we receive questions from everyone so that we know what the vibe is, what people are talking about, what people are. So it's trying to minimize the bias that a group will always have, of course.
No, I think that's
very important, Annie.
Yeah, I think that what you said is really important to calm people down. And about the technique. So about the technique, you are there, you have a time, and you need to answer these questions in that certain amount of time. So we always say you need to start by the questions that you know the answer, straightforward. That's it. You don't know the answer. Would you advise that? You skip to the next one. And you just first answer all the questions that you know 100% the answer, that you don't hesitate. And then you come back, or do you have a technique like that or not at all?
I don't know. I think we're all different in that way. Some people stress out if they see questions. I normally I open and I go in order. That's what I normally tend to do, because I think I don't like to waste time. I just go, and if I have one that I think I may need to revisit this one later, I'll revisit this one later. But so the structure of the exam, the internal medicine cardiology, is you have short answer questions, you have multiple choice, and then you have the practicals where you basically are shown images and you ask to make a spot on spot diagnosis. And then there's an oral case management, a short discussion about a few cases. So it's a very complex process, and it tries to evaluate your depth of knowledge, your wealth of knowledge, your practical kind of reading images. No one assesses anyone on their skills, on the practical skills. That should be done during your training. And that's something that's also very important. When a program supervisor writes the letter to the college to say, I've delivered the training to this person, then we believe that, yes, the training was delivered, they've been exposed to the cases, and then there's a lot of reading involved in the final parts. But I do think that there's a lot of merit in that. We read the publication, everything that's published, all the books that we have. And again, you need to choose them accordingly. If you're very well trained on ECGs, probably focus more on studying anything else.
And I think that there's also, I felt also as a resident, I think that doesn't matter how good you are trained during your residency, even if you've done a lot of mock exams or you haven't done any, or your supervisors are training you for the exam or to be a specialist, or both together, you always feel, I don't know what I need to study. No one has told me exactly what I need to study. But that is done in purpose. Like you're not isolated. It's not because you've done a residency in the middle of nowhere. No, every resident has that same feeling. You don't know exactly if you need to read all the papers, or some of them, all the books, until how deep all the books. You have a reading list for the papers, for the journals, for the books. But then I think that could be a very, very interesting tip. If you have a subject and you're thinking, do I really need to study this? Is this important? A tip could be that, okay, write a question about it. Do you think that you could write a question and give an example? This is how this question should be marked. If you can, probably that may not need to go into the exam. Because if you're not able to give a specific answer that is supported by books or by strong literature, then probably it's not going to be in the exam. One single case report of, I mean, maybe the discussion will be important. And sometimes in certain cases report, you have a very good discussion that talks to you about the physiology of something that has been very well studied previously. But you need a strong support to answer that question and to show everyone, like, this is why everyone answering these 3 points, 4 points, they're going to have a good answer on this question. Any other tips that I have missed regarding exam?
I think practicing exam. I think practicing exam. So I do think, like, I don't know how you felt, but I felt that at some point I peaked, exactly like you're saying. I was holding books towards the end, and I just couldn't grab any more information. So I think training is important. And so I couldn't do more than 6 weeks before my exam, realistically. And I think the last week I probably just handled the books more than anything else. But there's a lot of training involved. So the year is almost like running. You don't start by running a marathon. You're starting by doing 5K, 10K, and then you move on from that. So I think there's a lot of practicing in that, and that's very important. So don't think that you're suddenly going to sit down and be able to sit all day for 4 weeks. No, you need to practice, need to train your brain to have that level of impression. And then everyone memorizes things differently. Some are more imaging, some are more writing, some are more just reading. So I think know yourself, know what works better for you. I think practicing exam technique is very, very important, Anya, like you say. And even being exposed to the nervousness of that setting, I think it's important. And that's a work that your team of supervisors of the university will hopefully support you in that. And they should be supporting you in that. And then on the day, just trying to use the techniques that you know that you need to use to calm down, to be the best that you can, and understand that it's a lot of luck involved with these exams. You could be lucky and have a big question on something that you absolutely nailed, or it could be unlucky that it's just one of those things that you didn't have enough time to grasp. But the whole process is complex, but it is balanced. Okay, we try to make it as balanced as we can, so that we don't benefit one candidate that's been exposed to one thing more than the other.
Yeah, I think that's very important. And I think that I like a lot that kind of creating the questions. And to me, the most important tips, creating the questions, and then also checking with other residents if you feel, because what are the part of your specialty that you haven't been that exposed, but compared to other people that they have been more exposed, so you really see what is the level that you have and how extra effort you need to put into that part of the specialty, because in every exam there is a different fields. So it's going to be ECG for cardio, is it going to be electrodiagnostic for neuro, is it going to be imaging for cardio for neuro. Thank you very much, guys. I hope that this helped, and the best of luck to all of those are sitting the exam soon or in the future. And we got you. You got this.
That's right.
Thank you, guys.